Of course, I got put in TikTok jail because I violated TikTok's, you know, guides and services and all that other good jazz, or the community guidelines. So that's what your boy did. Let's see who else is gonna pop up in here. So I don't know who's just now joining me. Man, I had a good amount of people up in here that were just interested in what I had to say. But yeah, I got put in TikTok jail for like 10 minutes, I think. I got put in TikTok jail. So let me give it a minute, see who else is gonna jump back up in here. Probably not. It's already 6 o'clock, and people are probably just like, meh. Who else is gonna jump back up in here? Probably not. It's already 6 o'clock, and people are probably just like, meh. Well, it's 6 o'clock Texas time, so Texas time, there's that. So, what's up, everybody? Hey, hey, hey! I got put in TikTok jail, so I'm trying to recoup everybody that I lost. I guess the drive is exciting at that. So, hope everybody's doing all right. I was safe. I'm assuming either TikTok was just like, nah, bro, you can't be doing that while you're driving, or somebody reported me for driving, which either way, I mean, I ain't mad at it. I'm not mad at it because, social media ain't like that. It ain't all that serious, but we all about safety, so that's cool. I ain't mad at whoever reported me, or if TikTok was just watching me, because that's what they do. So what state do I live in? I live in Texas. Is it Mary or Mari? I live in Texas. So I'm starting nursing school. Oh, that's great. Congratulations to you for starting nursing school. It's going to be a long endurance of a journey, but you're going to be all right. You're gonna shatter it. So, my baby has a rare condition, needs surgery to save his leg. Candy apple. I don't know what that means. What you mean? Oh, you talking about cash apping, bro? We don't do that here. So nope. Sorry, we don't do that here. We don't jump in people's chat asking for money. It's unfortunate if you do have that issue going on with your child, though. So I'm getting my associates, though. It doesn't matter what you're getting, because guess what? That license is still the same. This is something I'm going to tell y'all, all right? You have people that are out here that are just like, I got my BSN, I got my ADN. Yo, who cares, bro? Like, who cares? You want to know why? Because that RN is still the same. Same thing with LPNs that are out here. Like, cool, you're an LPN. That's Gucci. You're good to go out here. Like, for real. You know what I'm saying? Like, it doesn't matter what your degree is. Like, always progress up. Always progress up. That's what I always like to try to tell people, man. Like, progress up. Like, if you have an LPN and you want to move up to be an RN, do that. If you have a bachelor's degree or an associate's degree, but you're still an RN, you're still RN, you still take the same test. Don't matter. It does not matter which one it is. So we're going to try to just, kind of just get rid of that whole, just that nonsense of me having a BSN or an ASN or whatever you want to call it. Right. So, it doesn't matter if you get your associates, because you can still progress up. It doesn't matter if you're an LPN, you can still progress to an RN. It doesn't matter if you're a BSN, you can still progress up to a master's degree. It doesn't matter as long as you're progressing in a positive manner. So, am I in Memphis? No, Debbie, I am in Texas. Because I don't know if you ever heard me, I say Texas time. So, just got 2 more tests left. Maternity, starting med surg in the fall. You're gonna be all right, Jay Quellen, you're gonna be all right over there. Exactly my point. Yep. When you start in nursing school here in Texas, and where in Texas? I'm already a nurse. I've been a nurse. Are you talking to me? Is it Najma? Najma? Are you talking to me? Because I'm already a nurse. I've been a nurse for a while. So, so what happened? Some comments got filtered. Maybe Nurse Nelly out here saying some foolishness. Texas in the house. Hey, all day, every day. All day, every day. Hey, y'all. What's up, Army wife? Hey, I'm just letting you know I came up there this weekend and I got me some yaki. I posted it on freaking on Instagram. I told you I only go to one spot when I go up to Killeen, and that's off Gray Street. Start nursing school August 28th. What do you recommend on studying right now? I would recommend studying nursing fundamentals and health assessments. Also, I would also recommend getting yourself an NCLEX review for $48, and you get it forever. See what I did there? See what I did there? I'm just saying. But anyways, I would recommend doing fundamentals because your first semester is going to be about fundamentals. The fundamentals of nursing, basic care and comfort and all that good jazz. Cooking quesadillas, rice and beans. Okay, yeah, I remember you said that. Yeah, Najma, I'm a nurse. I've been a nurse for 3 years. I've been a nurse for 3 years. I've worked in the ICU, worked in the OR, and I worked in PACU, so I got a little bit of experience. So, hey, best dosage calculations. What about dosage calculations? Oh, yeah, you need to know about dosage calculations. Yep, you can do that. Any tips for NCLEX? Study for it. I always say this all the time in regards to the NCLEX. Study schedule, time management, recreate the testing center. That's how you get over your test anxiety. Cut everybody off. Remember, your license is going to say your name, your first name, your last name. It's going to say RN. It's going to say LPN, going to have a license number, all that good stuff. It's not going to say your first name, last name, or your husband, or your wife, or your kids, or your Mima, or whoever the hell. Like, it's not going to be there. It's you. So you have to be able to take this time to do what you need to do for you, so you can take care of somebody else. That's how I always put it. Boy, it's crazy. It's crazy. You use a substitute version of my name. My bad. I'm sorry. I'm in class in Waco. You in Waco? Hey, I ain't been to Waco since I've been in high school. Hey, I know what the real Waco look like. There ain't nobody out there trying to fool me. No HGTV is about to tell me what, Magnolia or whatever they talk about. Whatever. Look, they ain't fooling me. I know what Waco really look like. Okay. You're welcome. Someone asked what to study. I think dosage calculation. Yeah, dosage calculation. So dosage calculations is great for you to get an understanding, but the reality of it, you need to get the content of everything else. And in all reality, fundamentals and health assessment are the very foundations of starting as a nursing student. I am a nurse for 37 years now, so a bit of experience, I guess. I guess, and you got a little bit of experience coming in here with your 37 years of it. I ain't even 37 yet. I don't know how that makes you feel, but I appreciate you being here. Did you hear that the NCLEX is now including case studies? Absolutely. I know that that happened on April 1st of this year, that they include case studies, also with scenarios. They also have extended multiple responses. I got a whole lecture ready for that. As a matter of fact, I actually, in my NCLEX course, the 7-day NCLEX course, I actually put up a video with the NCLEX test plan talking about all of the question types that are inside of the NCLEX itself, to include the old questions as well as the new questions that they add. Oh, I'm sorry. It's not necessarily that they're adding new questions. It's just the format of how they're asking you. And the case studies is a different format of how they're asking you. You can get 6 questions out of one case study, which is not bad because all the information is given to you right there in one question. All right. So yes, I knew very much HGTV. You know what I'm talking about. I failed my NCLEX on Saturday. Nia, I failed my NCLEX 3 times. So here, I'm going to tell you right now. Did you get your breakdown? If you didn't, if anybody's ever failed the NCLEX and you've never gotten a breakdown, I need for y'all to get a hold of your board of nursing and tell them to send you a breakdown. And I'm going to show you what it looks like. This is what mine looks like. This is what 1 of 3 look like, right? And I say that with pride because ain't nobody in this group and ain't nobody at no hospital gonna tell me any type of way about me failing an exam. Like, you're not gonna make me feel like shit. You're not gonna make me do anything because I know that this right here shows growth because I got one right here, I got one right there, and then I got another one inside of a drawer somewhere, right? So everybody should, if you fail, if you don't get a breakdown that looks something like this, like where you see it says, like, where does it say? Nope, it's on the other side. So it's right here. So below the passing standard, like if you don't see stuff like, you need to get that because that right there shows you where you need to focus on so you can improve. All right. And then the next thing I'm going to ask you is, what are you going to do to improve? And then I'm going to ask you, okay, so what reasons do you think that you didn't do so well? Right. And don't ever come to me where we're like, well, I guess. If anybody ever comes to me with an I guess, I'm going to be like, there's no I guess. Just like there's no I try. It's either you did it or you didn't do it. One of the two. Okay, I'm glad I took the old NCLEX. Haley, the old NCLEX, honestly, I would have rather taken this NCLEX. I'm not even going to lie to you. Because, they allow partial credit now. I mean, think about it, Haley. Think about those select all that apply questions. Right? You either had to get them all right or you got the whole question wrong. Now you can actually get partial credit to where you have points overall that can help you pass your exam. It's okay. Regroup and get a study schedule and breathe. Yeah, you good. You going to be all right. I start nursing school on the 21st. Why are you crying? This is what you wanted. I don't know what you're crying for. This is what you wanted. It's so easier. So it's easier now or harder. It all just depends. To me, so it all depends on you. The whole point of the NCLEX changing to the format of which it's changed to is to increase your critical thinking and your clinical judgment. I need to be able to give you, not my wallet, but I need to be able to give you a scenario. And then you need to be able to use your critical thinking and your clinical judgment to make a sound decision on how to take care of your patient. That's what it is. So if you're able to sit here and if I can give you something and then you can follow those trends, you know, and then once you figure out that one thing where it goes from there, you're able to figure out what's going on with your patient to better take care of your patient. Thanks for being honest. You're welcome. I take my test in less than 2 months. I failed 3 times. I claimed this fourth, and I'm getting my, yeah, that's right. Who said that? Queen Flo, look, hey, claim it. I'm all about words of affirmation. I'm all about putting it out into the universe. I'm all about speaking it into existence. You better speak it into existence. There's a book that I'm reading. It says, what you think you are or something like that. I read it on Audible. It's about a 2-hour long, but essentially what it's saying is whatever you think about yourself, you will become. So if you are out here saying that I'm going to fail it, you're going to fail it. I used to be like that all the time. I'm like, well, fuck it. If I fail it, I fail it. And then what happened? I failed every single time, every time. And then the last time I said, oh, I'm going to be a nurse. And now look at me after my 4th time. I said I was going to be a nurse and here I am. So you speak it into existence. You're claiming it. So it's going to be yours. How do I register with you, sir? Can you pin the link? So the link, I don't know exactly what you're talking about. If you're talking about for the 7-day NCLEX course, which is in its pre-launch phase, that link is in my bio. If you want to check my chat. Hey, so shout out to the emo nurse practitioner. If you guys don't know who she is, I talk about her all the time. Y'all need to go over and y'all need to follow her on Instagram right now. I need all 82 of y'all to go over there and I need 82 people to be following her. She's actually a really good friend of mine. She's one of the nurse practitioners that I worked with when I was working in the ICU. I learned a lot from her. Her and I have been through many of Code Blues together. Her and I have a trauma bond because of all this crazy shit that we saw during COVID. So shout out to you, Jana. Shout out to you for jumping into the chat. She has COVID right now. She's my Bessie with the Tessie. She got a Tesla and she needs to let me have it. Oh my God. So shout out to all 75 of y'all that are in here. 75, yo. Let me tell you something. That makes me happy that I got so many people that are in here. So if you have never been to one of these lives before, my name is Kevin. I go by the Boot Nurse. I was in TikTok jail for about 10 minutes because I was driving while I was on TikTok. So I don't ever do that. So welcome to the live. If you haven't followed me on anything, make sure you guys follow me on all those social media platforms. So of course, TikTok, Instagram, Facebook, join the Facebook group, the Boot Nation. Follow me on YouTube, which is at the Boot Nurse and all that good stuff. If you or anybody else you know needs help with NCLEX, you can check me out. The link is in the bio, 7-day NCLEX course. It is in its pre-launch phase, which means it is continuously being updated by me. I record all my videos and I edit all of them. So you got to give me some time to get them up there. You got to give me some time to record them. So I appreciate everybody's feedback and patience with that. It's going for $48. And once you get it forever. So check it out. But here's something I want to know about everybody that's new, or even if you're not new, if you just want to tell me again, so I can just tell you, I already know that about you. I want to know who you are, where you're from, where you're at in your nursing journey. Have you taken the NCLEX multiple times? And you know, I want to know essentially whatever y'all want to talk about. Like we're creating dialogue as well as we're creating a conducive environment for those that want to become nurses. And, you know, also for nurses, like myself to essentially vent and to kind of keep it real for what we go through, because it's the things that schools won't tell you. They try to do scare tactics about, you know, what's going to happen or, you know, what it's like to work. I'm going to tell you exactly what's going to happen based off of my experience of what I've experienced. But all in all, I really do love the nursing field, but my biggest passion is in teaching. I've been an instructor. I was a master instructor while I was in the Navy, and I've been essentially teaching ever since. So going on, I think January will make it 9 years. So I love teaching. I'm going to go back to school to get my master's in education, and that's kind of just where it's following. So whatever questions, comments you guys got, drop them down. Nurse Nelly is my co-host, so she answers all my questions that I miss. So if I miss them, hey, and if I miss them and you really want to ask me, ask them again. Now I got 35 messages I got to scroll through. Taking my NCLEX on Friday. I've been studying over a month, but not looking well on Archer. Any advice? Keep studying. You need to figure out why you're not doing so well. Is it the question? This is for Cleo. Is it the question not understanding? Are you not getting enough content? Are you being distracted? So you're borderline. So borderline doesn't mean that you're failing. I mean, and like I said, it's all an indication. It doesn't mean that you're going to fail necessarily. Cleo, this is for you, Cleo. So think about that as well. And also think about what is it that you're not understanding, right? You have to really dig into the weeds and get your clinical thinking and your critical thinking and your clinical judgment going. Okay. Goddamn, 4 times. I don't know what that means. Andreas or Andre, 4 times. I don't know what that means. Are you saying that I failed it 4 times? I'm assuming that's what you meant. So, yep, answer that. How do you feel about travel nursing? Travel nursing is great, but one thing I'll tell any new nurse before you decide to travel, make sure that you get at least a year, at the bare minimum of a year of experience before you decide to go travel. Because once you travel to another facility, either be out of state or in state or wherever, they're going to assume you know everything and they're going to throw you to the wolves. So you got to be very prepared for that. Amanda, it don't matter how many times you take it, just do you, babe. You got this. That's facts. Hey, like I said all the time, it doesn't matter how many times you take this exam. It doesn't determine the type of exam. I mean, it doesn't determine what type of a nurse that you're going to be. Only you can determine that. So if you want to decide, you want to take it one time and then go be a shitbag nurse, you're going to be a shitbag nurse. No one's going to be like, oh, you're a shitbag nurse. I took it once. No one's going to fucking care about that. No one cares about that at all. So just keep pushing. Let's see. Oh, as a matter of fact, I need at least 1,000 likes. All of y'all. I got 56 people in here. So that math is at least 1,000 apiece. So make it happen right now. I love you. Thanks. So, also y'all don't pay attention to my nonsense. I promise I'm professional. Hey, Jana is very professional, y'all. She's good peoples. Tips for pre-nursing students getting ready to take, my HESI tips to study, when I don't want to. The tip to study when you don't want to is to do it. It's not necessarily about motivation. It's all about having discipline. If you don't have discipline, you have nothing. So you need to discipline yourself. That's why I always say, get to the point of putting yourself on a schedule. Get to the point of becoming regimented. The moment that you stay in that, you'll be able to accomplish anything. You have to have discipline to get through it. And I also think about this. This is for Matthew. Think about what'll happen if you don't study. You ain't getting into nursing school and you're going to stay a pre-nursing student. We need to go from pre-nursing student to nursing graduate to nurse. It doesn't matter if it's a registered nurse or a licensed practical nurse or a licensed vocational nurse, because they're still nurses in the title. All right. So you got to have discipline. Let's see. I'm in Florida starting nursing school. Mario, I think you told me that already. See, I remember that. I'm from Boston, Massachusetts, Beantown, Boston. Shout out to Boston. I know a few people there. I'm Haley BSN, passing NCLEX January 1st. Took it once. I live in Kentucky right now, but from Indiana. Hey, I know some people from Indiana. Haley, where do they live at? In Muncie. I don't know where exactly that is geographically in that state, but I just know it's a really small old town close to Ball State somewhere. I don't know. So you're from Delaware? Jimmy, first of all, why are you in Delaware? Never did I ever know that anybody was in Delaware, right? Tips for NLN packs, please. You're from Boston. I don't know what what does that mean? You gotta really elaborate. Nurse Nelly, 34, female from Texas. Okay, you think this is the AOL chat, Nurse Nelly? So saying ASL, what you doing? From Cali, and I'm applying for nursing school and studying for my T's. Shout out to you, Melissa, for studying for your T's. I'm wanting to be an L&D nurse, but I'm so lost. So why are you so lost about being an L&D nurse if you're telling me that's what you want? Is that Lakin, 1986? What are you lost on? Charities from Maryland taking NCLEX this month. Shout out to you. Make sure you stay disciplined. Make sure you stay studying. I'm a teacher in Florida, starting nursing school on my birthday, October 28th, August 28th. I said October because that's when my birthday is. So, okay. What is it? Is it K? Is it Katie? Kai? Correct me if I'm wrong, please. Boston taking okay. Ruthie, what is the NLN packs? I honestly don't know what that is. Like, I know a lot of things, but I have no idea what that is. So please educate me on what that is. Is it too late to attend nursing school in your mid-30s? No, princess. What you mean? I got people out here that are in their 50s going to nursing school. Why is it that everybody thinks that your age has anything to do with you going to nursing school? Like, your age has nothing to do with you getting an education for yourself at all. You see that degree right there? It don't say it does not say my age on it. And I'm 35. And I got my I got my license when I was 32, and I got my degree when I was 32 or 31, something like that. Well, I was 31 when I got my degree, and I was 32 when I got my license. No one cares how old you are. Stop bringing age up into this. Just because, here's a good thing about you being in your 30s is that it actually makes you a better student because you have a lot more to strive for versus how the younger students are. Because I'm not saying anything bad about anybody that's 19, 20, 21 years old becoming a nurse, but you being in your 30s, you have a lot more life experience than them. So you feel like a lot more, you have a lot more to lose than they do, So don't ever make it about age, because I'm telling you right now, your degree and your license ain't going to show your age on it. Trust and believe me. Minnesota taking NCLEX next month. Shout out to you, Lady H. You're going to do great. Tips for pre-nursing students. I think I already answered you, Matthew. I'm 34 and I'm starting now. Shout out to you, Mari. Tips for pharmacology. Know your family name and suffixes. So everything. So like know that, all LOLs are beta blockers. All beta blockers are LOLs. Know your signs and symptoms, right? Do you have your CCRN? Pixie, I do not have my CCRN. I was not in the ICU long enough for me to get it. I wasn't in ICU long enough to get it. I was actually working on getting my CNOR, but I don't even know if I want to do that anymore. It all just depends on how I feel. So it all just depends. But currently I do not. My journey started LPN, RN, BSN, Ohio native, Texas, till I win the lottery. Hey, good luck on winning that lottery because I know it's kind of high right now. But shout out to you, Army wife, RN. Hey, I'm trying to tell you, I went to go get that yaki and it was delicious. I got a 50 piece, but I shared it amongst people. So I ain't all that fat trying to eat all that stuff. Use the HESI workbook. The HESI workbook is good. I also use another book. I also recommend it. I am going to make a TikTok about it. I really got to start penning links up in here so it's a little bit easier for you guys, but I'm still kind of trying to learn TikTok's nuances of stuff. I took the LPN NCLEX once, the RN NCLEX 3 times. I've been gainfully employed as a bomb nurse. Facts. 1,000. Shout out to Mari. I see my 1,000 likes. I love y'all, man. Y'all are gangsta out here. That was deep, bro. Just don't think I can pass that HESI exam. Guess I got to change my ways. If you don't change your mindset, I even have a section in my NCLEX review that I'm creating called the NCLEX mindset. Like, it's all about time management, accountability, understanding content, understanding questions. But then you really got to put into perspective, how bad do you want this? Don't come to me. Say, there's a lot of, what did I say I didn't like? I don't want to hear I guess. I guess that's telling me you're not definite. I would rather you make a good decision now than try to make a great decision later, because doing it now, you learn as you go. This is for Matthew. All right. I know I got another 29 messages to go, but this is for you, Matthew. It's just like, I know that it's deep. This is deep. This is deep conversations that I try to have with people, is that there is no guess. Just like Yoda, either you do it, you do or do not. There is no try. There is no guess. You have to do it. There's no, I guess I need to change my ways. You have to change your ways. I'm not always definite when I tell people stuff. I always suggest things because me telling you what you need to do makes it a true statement, and it's not necessarily true, but you have to change your mindset at this point, because if you don't, then you're not going to do well, not just on your exams, but on other type of decision that you're going to make in life. So you got to change it, and you have to push. How do I start my journey off becoming a nurse? I want to be an L&D. Okay, Lakin. Now that makes more sense. My suggestion to you, if you want to become a nurse, especially a labor and delivery nurse, join Facebook groups that for people that want to be nurses. Volunteer at a hospital, but then volunteer at a hospital to work in a labor and delivery. As a volunteer, they actually have programs where you can volunteer in the labor and delivery, where you can actually hold the babies and feed them. I've actually seen it, but there may be an age limit, because I think it's only for seniors, maybe 55 and older. And I ain't saying that you 55 or nothing like that, but I'm just saying. All right. So look into that. Of course, look into those hospitals, and also follow, it's not hard for you to look on TikTok and put, I'm pretty sure there's a nurse that says, there's a nurse that's on TikTok that says L&D nurses. But, if you want to become an L&D nurse, put yourself in the mindset and the perspective of a nurse. Look at schools, look at prerequisites, so on and so forth. If labor and delivery is where you want to be, think like a labor and delivery nurse and go find you one. Okay. Are you treated with respect in the hospital? For the most part, most people respect one another until they open up their mouth and then they think that they can talk to you like they're crazy. This is for Dustin. For the most part, I'm respected. The thing about it is just like no one should ever come up to you and disrespect you. That nurses eat their young shit is actually probably one of the things that really kind of just really trips me out. And so when somebody tries to be disrespectful to me, a lot of this, and I say this all the time, a lot of this comes out my military side. And I'm just like, okay, yeah, absolutely. Yeah, sure. And then when they say something crazy to me, I'm just like, hey, who are you talking to? And then instantly, tones change. And I was like, yo, I'm not your son and I'm not your husband. So don't talk to me like you've lost your fucking mind. And then they're just like, oh, and then I never have a problem after that. Because sometimes if you don't put your foot down, then people are going to walk all over you. And I don't allow for people to walk all over me or for them to walk all over anybody else in my presence. I don't like that, especially when I see nurses that work on floors do it to students that are trying to be nurses. I have a story for y'all about that, but I want to try to get through all these comments. Hold up, come visit Delaware. Wait, Jimmy, you're in Delaware? I ain't coming to visit. What's wrong with you? I have no clue where to start. Well, I told you where to start. Who is this? Lex, I take my NCLEX tomorrow. I feel confident. Any tips on how to prepare the day before? Oh, that's a good one. So make sure you have everything lined up, as in like all the things that you need, like have your ID card, make sure you have your keys, have your outfit and stuff laid out, all that stuff. And I don't know where you live or if you have any kids or anything like that, go to bed early because you're already going to be nervous. Right? I already know that you're going to feel nervous. So who is this? Lex and Tidezod. I don't know. I hopefully I said that right. But you need to go to bed early and try to go to bed as early as possible. And then, of course, wake up. I'm all about words of affirmation. I like to listen to really good podcasts about motivation. So listen to some motivational stuff on the way there. And then before you get your ass out of your car, you need to say to yourself, I will be a nurse. And then let that be the last thing you say to yourself and then go into your testing exam. Okay. You're going to do great. And then when you do great and when you pass it, I need for you to come back here and I need for you to let us all know. All right. Hi, I'm a pre-nursing student now and I'm 44. Shout out to you, Yolanda. Amen. Shout out to you, Charity. Melissa. Yep, that's true. Currently a CNA. So you have a non-nursing degree. From African country. Can I go on with ADN? How much? It all just depends on what school you're trying to go to in regards to how much. And if you have a non-nursing degree from an African country, it all just depends on what credentialing wants to do. I have a feeling that they may not take all of your credits or none of your credits. It also, Mangi? They may start you all over. So you just got to be prepared for that. Grandpa Boot Nurse. Hey, first of all, is it because I said I was 35? Don't do that. Okay. I have had family tell me I am too old to go back. So those people that are telling you that you're too old to go back to school, I'm gonna need for you to just kind of like keep them away because it's people like that are already in a set mindset that have no business being in your ear when you're trying to progress through your life. None whatsoever. Do you recommend working while in nursing school? Don't have to work if I don't gotta. I worked full time while I was in nursing school. I was an instructor. I was active duty. I was an instructor in a surgical tech program while I was on active duty while I was in nursing school. So can you work full time? Yes. Would I recommend it? It depends on, how you are financially. If I had the choice to not go to work and go to school, then I would not go to work. But, the way that my checking account is set up, with my checking and my savings, it just don't work that way. So, it all depends on how it is for you financially. What if someone went to school to be a teacher, but now they want to change careers? Then you can go and change careers. There's nothing wrong with that. And you have no idea how important being a teacher is, because with your teaching aspect, you probably have very good study habits. And this is for Lola. You probably have very good study habits. So if you go and become a nurse, imagine how your study habits and your teaching ability will convert to being a nurse. And you end up becoming a nurse educator. You have no idea how valuable that is. So I think it's actually a great idea for you to do, because remember, I was an instructor and then I became a nurse, and now I teach. I created my own course, and now I coach people for NCLEX. I got offered a teaching job, to be an adjunct instructor. So it's like the education realm, whether people want to believe it or not, if you use it the right way, it could very much benefit you. All right. Any advice for taking the T's? This is for Melissa. Study for it and get yourself a good book. Mometrics is a good book. It's that yellow book you can get off Amazon. It's like $33. Have you done travel nursing? And this is is it Uriel? No, I have not done travel nursing. Wait, a 50 piece? Yeah, I know I'm late, but a 50 piece, but I didn't eat it all by myself. I had other people. Is respiratory therapist a good career? Aaron, I'm assuming your name is Aaron, so hopefully I'm saying this right. Respiratory therapists, they can make some pretty good money. Like during COVID, those the respiratory therapists that were traveling, they within a year they were pulling in over $250,000. But that was during COVID. Everything was new. But if airway is your realm of expertise and learning, and that's what you want to learn about, then respiratory therapy can be good. Any career can be a good career if you know how to navigate through it. So this one is for Little Miss Sunshine, a new nursing student here, LPN to RN, maybe NP. That's a long way off. I mean, you'd be surprised. It may not be a long way off. You can get that RN and then jump right into an NP program and then be an NP within the next year. In reality, it's really not that far off. Has anyone told you that you look like an actor, Harold? No. Miss Lady Jacka, I have not heard that before. Now you're about to make me look him up. So I have not heard. I've heard Jason Derulo. I've heard like 2 or 3 other ones on Monday, and I was just like, yo, y'all wilding out. Okay. Is travel nursing? Yeah, travel nursing. You can pass for sure. It's definitely on my mindset. Do you have to get your ADN first, or can you go straight to BSN? Lakin, I got my BSN straight. I didn't go to an ADN program. In reality, if I could have done it all over again, I would have gotten my ADN because that would have gotten me into the nursing field faster. And I would have just been able to take classes to get my BSN, and I would have been okay at that point. So there are many different routes that you can do. You can go either route. Yep. I got my ADN, started working, did my BSN online while working. Yep. I will pass. Yep. You sure will, Matthew. And be able to apply in 14 days. Thank you so much. I'm gonna message you when I want to know. I want to know when it happens. I'm in pre-nursing. Yeah, I'm in pre-nursing. Should I start looking at NCLEX? And in all honestly, Yolanda, if you decide to buy an NCLEX course, preferably mine, it's good for you to have now. But in reality, you're not really going to understand all of the questions because you're not going to have a foundation of what nursing really is. But I mean, for you to have it now and then for you to use it later for $48, you spent more on Amazon Prime Day. I'm just keeping it real. So, but do I think you need to be looking at NCLEX right now? Not really, because you're not going to have the foundation of nursing yet. But as you start to go through nursing school, most definitely start looking at it little by little. And then it's going to be really important during your last semester of school. PACS is the entry exam under Mometrics. I hope you have an idea about it. I've never used Mometrics. I've seen the book, but I've never used that before. Acceptance letter. Okay. Prerequisites is just taking like your basic courses, right? Yes. So every program, it doesn't matter, not just necessarily nursing, but they have prerequisite classes that you need to take in order to be considered for that program. So for nursing, it's usually like A&P 1 and 2, micro, chemistry, statistics, college algebra, nutrition, human growth and development, so on and so forth. And some schools require you to have more. So you just have to look at what the school's prerequisites are, depending on which one you want to go to. I'm sorry, I failed as a co-host. I'm cooking dinner. Yeah, I know you said you were cooking dinner. Yes, A&P chemistry. Thoughts on Nightingale College only BSN program? Melissa, personally, I don't know anything about Nightingale College. That would require you to do a little bit more research. As a matter of fact, why don't you do a little bit of research and you let us know? Because, if you do a little bit of research and you let other people know, it may be helpful for them. I'll be graduating from TAM UCC. Hey, shout out to that. Shout out to you, Mark, because that's where I went to school with my BSN next week. How long have you been a nurse? I've been a nurse for 3 years, and I actually went to TAM UCC and I graduated in 2018. You want a plate? Look, for real, I send that plate over. Is it Aubrey that's cooking? Because she can send me a plate too. Amanda, hey, I take my NCLEX in September for LVN. Shout out to you, Amanda, for taking it. So make sure you're studying. Make sure you get a good foundation. Recreate your testing center in your house or whatever that you can do for yourself. Eliminate your distractions. Study your questions. Do your rationales. Review them. so on and so forth. You're going to do great when you take your NCLEX. If you already have a bachelor's degree, can you do an accelerated bachelor's program usually? If you already have your bachelor's degree, you can actually jump into some direct entry master's degree programs for nurses. But if you have a bachelor's degree and if you want to turn around and go get another bachelor's, you can, if that's what you decide that you want to do. I will be a dialysis nurse and take my NCLEX in September. Any advice on next gen questions? Critical thinking. This is for Amanda. Critical thinking and clinical judgment. So I need to be able to give you some type of disease process, and I need to be able to I give you all this information, and you need to be able to tell me what route that you would take based off of the information that I've given you. Okay. I'm 55 and I want to go back, or I want to go to nursing school. Is that too late for me? Melody, no. Somebody let Melody know what I said earlier about age in regards to going back to school. If you haven't gotten your NCLEX results in 3 days, does it mean you failed? No, I would actually go to Pearson VUE and see if you can buy the quick results. And then I would check the Board of Nursing to see if your license even popped up there. Hi, I have a farting condition. Well, supernatural. You might want to get that checked out. ADHD and nursing school tips. This is with ADHD, it's all about eliminating any type of distractions that are anywhere near you. So like if you have a room full of clutter, get rid of it. I would rather your room look like a I don't know, like a psych ward where it's just lights and a blank wall, to where you don't have any distractions at all. So limit the amount of distractions in regards to ADHD, and hopefully that can kind of curve your thought process on everything that's going on while you're trying to study while you're in school. Why is it harder for women with kids to get through nursing school compared to women with none? Well, because kids are a damn distraction. And honestly, kids are a distraction, but it's not impossible. Nursing is 85% women. And I've been in classes, like all the girls around me at least had anywhere from 2 to 3 kids. A few of them were actually pregnant during the program. It's harder because, your first thing is a motherly instinct is to take care of them. And then what also happens is that you go off of your personal experience that you've experienced, like in labor and delivery, and then sometimes those personal experiences have you get the wrong answer. So women with no kids haven't experienced all the things that women who have been in labor and delivery before gone through, if that makes sense. Because I can tell you right now, like those girls, they knew a lot about how to do, we were talking about abrupto placenta. They were talking about, oh my God, what is it? Preeclampsia and stuff like that, because one of them had it. So she knew everything about it, but she started to get things wrong because she had personally experienced it versus understanding the nursing aspect of what the book wants you to know when you're studying in school and when you're going to take your exam. Okay. I really hope that helped. And I'm trying to catch up on all these, but I had no idea that there's so many people that are interested in listening to what I'm saying. Okay. But I'm going to take a break right now. First of all, I need everybody to smash that like button, and I want 5,000 likes right now. Make it happen. Hey, Nurse Nelly, you're the lady. So you better start yelling at folks to make it happen. I love y'all. Hey, if y'all are just now joining the live, my name is Kevin. I go by the Boot Nurse. I go on the Boot Nurse on all social media platforms. I want you guys to go check them out. Check out the Boot Nation Facebook group, trying to foster a conducive environment for learning for pre-nursing students, nursing students, and nurses alike, as well as if you know anybody that is studying for the NCLEX. I do NCLEX coaching. Check that out at thebootnurse.com. And if you're a nursing student who is just about to start nursing school, or if you're studying for your NCLEX and you have a little ways out for that, you can check out the 7-day NCLEX course. That link is in my bio. For $48 is 80% off. Once you get it forever. And I am slowly but surely updating content as we go. I have multiple phases of which I'm going to be updating things. So if you buy it now and you take your NCLEX 2 years from now, you're going to have an NCLEX review that's going to be $48. Hey, so shout out to y'all for jumping in it like it's Amazon Prime Day. But anyways, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Any questions that you have, my co-host and everybody else will answer those questions. We want to foster a really great environment down here. No question is a stupid question. I want to know all of it. I want to know all the tea. And I want you to tell me and tell them. All right. Now, let me catch back up because, Aisha graduates on the 25th. Shout out to you. Shout out to you for making it through. Did you take the HESI or the ATI? Henry, I took the HESI. Let's see. Can you tell me more about yourself? This is my first time on your page. Well, Yolanda, I would love to tell you a lot more about myself, but I would rather you go check it out on, you can either look at it on YouTube or you can check out my videos that I post on TikTok, and then you'll know a little bit about me. Once I get through all these questions, if I have some time, I'll kind of go back through my story, but I tell my story on here all the time, but I know I get new people. So, I'll go back through that. I wish every school had the same prerequisites. It would be so much easier to applying. I agree, Alex. There's some schools that'll be like, yeah, you need to take chemistry too. I'm like, bro, I didn't even like chemistry 1. What makes you think I want to take it a second time? Or some places like religious schools will make you take like a religious course. And I'm just like, look, I go get religion on Sunday. So I don't need to be coming here to be doing all that for you to tell me that if I got a B in this, it's going to hurt me. Right. So, I wish they were all the same, but unfortunately it's not like that. So that's why you got to pick and choose what school you want to go to. Any tips for the TEAS exam? Get yourself a really good study book. The Yellow Mometrics book that is on, Amazon. It's like, $33. It's a really good book. Nightingale College BSN is 100% online except for travel for clinical. So far, I heard good things. Well, Melissa, if you've heard really good things, that's a great thing. So I'll give you an example. I went to Texas A&M in Corpus Christi. My school was 100% online except for clinicals. I had to go to the local hospital, and it worked out really well. But I worked literally every day. So I was an instructor working from Monday to Friday. I did clinicals Saturday and Sunday, 12 hours apiece, to turn right back around to go back to my regular job on Monday. So it's a bit of a sacrifice that you have to do for yourself. You could be a little skeptical, but you got to think to yourself that there's other schools that you can apply for. You just got to look them up. I start on the 21st. Any advice for my first semester? Really, really hone in on your health assessment and your fundamentals of nursing. Don't be like me where you try to be hard-headed and thinking that you know everything, because you may or may not have medical experience. It doesn't necessarily have to be as a nurse or anything, but you may know a little something. But really hone in on the fundamentals of being a nurse, understanding what ADPI means, your basic care and comfort, safety, which is huge. And then you'll start to learn about pharmacology and all that other stuff. But that health assessment, how to properly take care of a patient. Let's see. Kind of scared of dosage calculation test. Don't be scared of it. Prepare for it. Like, do those questions over and over and over and over. Do you recommend be a CNA first before being a nurse? That all just depends on you. However, if you want to be a CNA, it exposes you to what nurses do. So, and in every question that you could remotely think of, you can ask a nurse, because they'll be right there within arm's reach. And then you can actually find yourself a good mentor, and then, hopefully get a good friendship out of that. There's a lot of PCTs or techs or whoever that I love to show them, what's not in their scope of practice and what they could be possibly learning in the future. And they love it. They love the fact that somebody that's a nurse will take the time to show them how to do things. Because I'm in the Navy, I'm a hospital corpsman, and, the nurses teach us and we teach the nurses. That's just kind of how it rolls. All right. Let's see. If you guys hear my son crying, he's just crying because he's crying. I don't know what he did. He's not breathing. Hold on. There it is. Okay. So he's good. He got a good set of lungs on him, y'all. He's Gucci out there. Yes, Aubrey is cooking with me, but it's still a lot. What are you making? Like pasta over there? Okay. Yeah, no problem, Yolanda. I got you, though. I ain't gonna forget. Hi, I'm going into semester 2 of 4, and I start pharm in a few weeks. How should I prep for it? I'm nervous. Don't be nervous. Don't be nervous. You just got to attack it, and you got to take it for what it is. So like I say about pharmacology, you want to know family name and suffixes, right? So, if I'm learning about beta blockers, every beta blocker is an LOL. Every LOL is a beta blocker. Okay. What are the signs and symptoms of somebody, or I'm sorry, what are the pharmacokinetics of what a beta blocker is going to do? Is it going to lower your blood pressure, lower your heart rate? Right? That's what that is our expected outcome, right? When do I hold that medication? What are the signs and symptoms for that medication? What are the safety implications of giving that medication? Once you understand that, then you can really tackle any type of medication. Okay. Right. Does the test differ from state to state? Natalie, what test are you talking about? Are you talking about the NCLEX? Are you talking about the licensing exam? Any advice on how to start studying for the PN NCLEX a month after graduating and I'm stuck? Any advice on how to start studying? So just like I say, when we study anything, you put yourself on a schedule, like an hourly schedule. Create a study plan for yourself, as in like, what is the toughest area that you have that you don't understand, and then you tackle that one first. So if it's pharmacology, start with pharmacology lectures. After the pharmacology lectures, for me, it was maternity. So then I went straight to maternity. I went all the way down these videos and I took notes. And then once I got through all my videos, I started all over again. Okay. So, recreating the testing center. So computer, I don't believe in taking quizzes on paper, because they stopped putting the NCLEX on paper like in 94. And some of y'all were born in like 2000. You see what I'm saying? So, so recreate the testing center, no distractions, no phone, no drinks, no nothing. So it's just computer, you. Have accountability for what you do and for what you don't do, you know? So that's what I would say is you have to get down the structure, and you have to get down the mindset to practice for the NCLEX. That will be my advice. And that's for you, Nicole. Can I do my schooling from home? You can define, Lakin, you can find nursing schools to where you can do them online, but clinicals, with the exception of what happened when COVID broke out, you can do all of your schoolwork, your didactic at home, but all your clinicals will be done at a facility of some sort. Either it be a nursing home or a long-term care facility or a hospital. Any advice on dosage calculations? I'm struggling. With dosage calculations, you need to know the formulas, and you honestly have to practice it. You have to practice it. Follow the formula. It's kind of like doing long multiplication or long division, like when we were learning in school, like when we were in elementary school. It's the exact same way. Know the formula. And once you know the formula, you have to practice it over and over and over and over. And honestly, in reality, when you take your NCLEX, you may get 2 dosage calculations questions. You may get 2 of them. However, when you're in school, they give you pharmacology questions and they give you dosage calculation tests. And some schools will make you get 100% on them, or else you will fail. Because the one thing about pharmacology is that you cannot fuck up on that. You cannot, especially when it comes to taking care of your patient. If anybody remembers the Redon-Devant story, if you do, go ahead and drop it down in the chat. But if you guys remember that story, that's a medication error. It doesn't have to necessarily do anything about dosage calculations, but it has something to do about medication, what dosage calculation usually talks about. All right. So that's why it's very important that you need to know about dosage calculation. Living the Johnson life. I'm in an accelerated ADN RN program, and I take my last final term tomorrow. Shout out to you. You're going to do great on that. Chicken quesadilla, fried beans and rice. Hey, shout out to you. Let me get some of that chicken quesadilla. I've been a CNA since 1983. Before you had to be certified, was certified in 2005. My mom was an LPN. Shout out to you. It was a Thicky Murray. Not for cans or packages. Okay. Not from cans to packages. Oh, for the NCLEX exam. So the NCLEX exam is a national exam. So it's a national exam. So every nursing student, every nursing graduate takes the same NCLEX exam. However, your questions will be different because it's a computer adaptive test. So you will get your first question, and based off of how you answer it, either wrong or right, the next question will be given to you based off of how you answer the previous question. It's like that the whole time. So the exam, Natalie, is a national exam. So it's not based off state by state. I just take my NCLEX and I failed. I really don't know what else to study or how to study. Okay. So just like I said to you, not to you, Marcia, because I think you're new here and I don't think you were in here when I said this. So you failed your NCLEX and you really don't know what to do. So the first thing I'm going to say to you is, why do you think you failed? That's number 1. Number 2, how did you study? Number 3, what did you study? Number 4, did you have distractions? Did you study effectively? There's a difference between studying and studying effectively. And by studying effectively, and I'm going to give you an example. Did you turn the TV on and just have the TV on, and then you had your laptop in front of you, or you were reading your book and people were talking to you, or if you have kids and they're acting the fuck up, doing something like that? Was that happening? Right? Were you sitting there? Did you work a full shift and then tried to sit there and study when you were falling asleep and you weren't able to retain that knowledge? How do you learn? Are you a kinesthetic learner? Are you auditory? Are you visual? Are you a read-write? How do you retain knowledge? There's a lot of things when it comes to studying. So those are the questions, Marcia, I would ask you on in regards to when you study for your exam. Getting ready to enroll soon. Have Diploma 1 medical assistant and one another in phlebotomy. Trying to find the app that I need to take my state board from South Carolina. Hey, shout out to you. My dad's from South Carolina. He's from Chester. So after taking your prereqs, then you apply for a nursing school or program. Is that considered doing your clinicals? No, Lakin, your clinicals are done. Your clinicals are a part. It's actually a separate class that is required in your nursing program. So when you do your prerequisites consist of all those classes that I stated earlier, which they do come with labs. But those classes need to be completed, or at least on the way to being completed prior to you starting your nursing program, if that makes sense. Martin, I got a night shift ICU spot, but I'm a morning person. They only have med surg available in the morning. Well, Martin, I'm going to tell you this. If you don't want to work nights, don't work nights. If you're a morning person, go work in the morning. Here's the great thing about the positions and the areas in a hospital in regards to being a nurse. They are never fucking going anywhere at all. So if you're a daytime person and they have med surg available, but you really don't want to go there, do you want to make the sacrifice of, working nights, but going to the ICU? Or do you want to work mornings, but you really don't want to be in med surg? Either way, it's like, at this point, it's like you can't really have your cake, you need it too, right? So it all just depends, Martin, on what you want to do. Like, do you really want to work in the ICU? Is that your goal? Do you want to get your CCRN? Are you trying to become a CRNA? Are you trying to be an acute care nurse practitioner? Like, are those the things that you're trying to do for yourself? Or would you rather wake up in the morning, go and be a day shift person, but go work in med surg where it's a little bit slower and not as high speed or not as fast as it is in the ICU, depending on the situation. But, you're working in med surg and you really don't want to work there. So it all just depends on you. Dimensional analysis is the easiest way to learn dosage calculation. Trust me. All right. Hey, that may work for you. But if you've never done dimensional analysis, then it's okay for you to learn a different way if you've never done it. So I don't disagree with you, Tara, at all. So Marvin, should I just tough knife shit out? I mean, if that's what you think you should do. So here's the thing. Everybody always comes to me because they want me to give them a definite answer. I can't give you a definite answer because I don't know how you live your life. I don't know how you live your life at all. So, I mean, you could be a crabby night person, you could go to nights and like it, I mean, it's all about, do you want to try something different? And what are you willing to give up? Are you willing to give up, being a day person and working at night and working in the ICU because that's really where you want to be? Or do you not want to work in the ICU, or are you just going to sacrifice not being in the ICU and then you just want to go to the med surg? Once again, that all just depends on you. If you think that you should tough it out, cool. But the great thing about it is let's just say you go to nights and you're just like, bro, I've been here for a month and I can't do this. Cool. Can't do it. Go somewhere else. That's okay. That's okay. Change is okay. Okay. Yes, I work. I have kids. I'm a visual learner. I just don't know. Well, you're a visual learner and you have kids. This is why I love a schedule. This is why I love a schedule. Like, you have kids. I don't know how old your children are. Obviously, Marsha, I don't know your family dynamics. So what I would say to you is that at this point, I would literally this is where you have to regiment yourself. And I'm a very regimented person. I'm very scheduled. I very seldom deviate from my schedule. It makes me feel like I don't have control, and I feel like I have to have control of some things. Put yourself on a schedule, and you're a visual learner. So that tells me that you can sit in front of this computer and I can put a PowerPoint in front of you and you would be able to learn what's going on in front of you. Right. So maybe that's just something. And it all just depends on what study material were you using? Were you looking in the book? Were you looking on an app? Were you looking on your iPad? A lot of people are just like, oh, I study on the go when I have time. And I was like, no, you need to make the time. Remember, we're all allotted the same 24 hours. And however you decide to allocate them, children or not, is however you decide to allocate them. And trust me, I wake up early. I have to go to work. Then I got to come home. I have kids. And then I stay up, and sometimes I don't go to bed till 1, 2 o'clock in the morning because I'm dedicated to getting my program out, especially for the fact that, people have already purchased it. So now I owe that to them because I have to make that sacrifice I have to make that sacrifice in order to provide for them. Right. So that's what you got to really think about. Like, this is where you have to do an audit, Marcia. That's what I like to call it. This is where you have to do an audit for yourself. Awesome advice, man. Glad I asked you. Yeah, Martin, no problem, man, because you got to think about it is that you can always change things up. You are never anchored to anywhere. Ask Nurse Nellie. Nurse Nellie worked in med-surg, then she worked in ICU. Now she does case management. You're never anchored down to anybody, any hospital, anything like that. MedSeas is high speed and fast paced, bro. My bad, bro. Sorry, because I was in the ICU. I don't know nothing about med-surg. I feel like I struck a nerve with Nurse Nellie for the fact that I said that. My bad. Jerome, what state do you work at? I work in Texas. I hated nights, but learned more on nights. You do. When you work nights, you get a lot of autonomy. Like, you get a lot of like, hey, you do it by yourself. And that's one thing I did like about nights. But then when I needed the support, especially when it comes to knowledge-based things, I didn't really get it on nights because, none of the doctors were there. It was an inconvenience for them. Some of the charge nurses were just terrible. Like, it's just, let's see. Lakin said, so what you're doing in nursing program, you can do that from home or at the school itself. Full-time mom to 2 boys and a full-time employee. Okay, Lakin. So let me make sure I'm understanding you correctly. So with your nursing program, when it comes to the didactic phase, meaning when it comes to the actual classroom aspect, you can do online and you can do from home, depending on the program that you apply for. So, like, I'll give you an example. Western Governors University it's all online. However, your clinicals are done in person at a facility of some sort. Okay. So even though you're a mom of 2 and you're a full-time employee, they don't care. Trust and believe me. Like, they don't care that you have kids. Everybody is held to the same standard. That's why I say that. Okay. So, you don't have to go to the school if the school doesn't require you to go to the school. But I can tell you most to all of online programs, you do all of your school work, your didactic work, where you're in the book and you're studying and all that other stuff, you do at home. But when it comes to clinicals, you do them at a facility. Okay. How hard? Hold on. I skipped somebody. Is that Tina? Tina said, why are nurses quitting? Oh, man. You know what, Tina? I'm going to let Nurse Nellie handle that one. Nurse Nellie, please answer that question for me. Because I will sit here and I will go all into it. What's up, Slushy? How hard is the HESI entrance exam? The HESI entrance, I'm just going to be completely honest with you. The HESI entrance exam is as hard as you make it. So the more that you prepare for it, Lana, the less hard it's going to be, which I would say get yourself a really good book. There's a really good book. You can look it up. It's by Trivium. And it's a 23-24 version. I use that same version, but I use the 16 to 17, version. And it's a really good book. I would definitely check it out. It's like $33 on Amazon, and you can't go wrong. Study it for about a good month, and you'll shatter that HESI exam. I guarantee it. I ran across your page at the right time because I was praying to God, telling him I need a coach. Hey, if anybody needs coaching, you can go over to my website. It's thebootnurse.com, and then look where it says the NCLEX Coaching and Mentoring. That is a paid service, by the way. I'm just letting everybody know that right now. But if that's not something that you're looking for, then of course I will always do these TikToks. Period. I will always do these TikToks.